growing up, I was exposed to communities around me that were predispositioned to poorer healthcare outcomes. And it just kind of inspired me to give back. I did public health research in my undergraduate with UC Irvine, the Centers of Disease Control in the state of California. We looked at things like access to green spaces and physical activity spaces in lower income communities throughout Southern California. Do we need to add more bike lanes? Do we need to add more walking pathways, lighting, things like that, things that you kind of don't think that would really impact public health or the health of a community, but they actually have very significant impacts. Those all kind of contributed to what fueled my passion and what continues to fuel it today. Now that I'm in New York City, I definitely have a lot of exposure to exactly how different one block or a couple avenues, just the impacts and differences that can impact a community. It's very unique to me, and well, it fascinates me, frankly. And I think there's always an area to kind of get involved in and make a change.
That was today's guest, Pavan Lohia. Hello and welcome everybody to Making Public Health Personal. This podcast is brought to you by the CUNY Graduate School of Public Health and Health Policy in New York City. I'm your host, Laura Mioli-Farragon. Thanks for listening. Today's guest is here to tell us about his unconventional path towards pre-med. Pavan Lohia graduated from CUNY SPH in 2020 with the Masters of Public Health, concentrating in population health and clinical sciences. He was awarded the Dean's Merit Award for Service, as well as honors from the Epsilon Chi chapter of the Delta Omega Public Health Honorary Society, of which he is a founding member and president. Pavan also served as president of the Graduate Student Association at CUNY SPH. From being a leader at his school to being a leader in public health, Pavan is the founder of Pav Life Group, a healthcare brand and investment firm that is redefining healthcare through knowledge, innovative technology, and capital investments. During his time as a clinical researcher at the Icahn School of Medicine at Mount Sinai, which was part of his fieldwork at CUNY SPH, he led major healthcare research projects related to COVID-19 and the long-term health impacts to the 9/11 World Trade Center workers. While working at the National Science Foundation, in 2019 he was selected from the Presidential Pathways Program, and he worked on international and national scale projects. This work led him to receive the 2021 Scientific Achievement of the Year Award from the NSF. In this episode, we'll talk about how Pavan went from MPH at CUNY SPH to currently pursuing his MD at Medical University of the Americas, and how he is proposing new evidence-based healthcare standards and initiatives showing the potential benefits these changes can bring to people's lives. So if you're looking to go pre-med but aren't sure how to get there, if you want to gain leadership skills and experience while still in school, or if you're just looking to hear from a thought leader who is dedicated to improving healthcare for us all, look no further. Let's get right into today's interview with CUNY SPH alum Pavan Lohia. Thanks for joining me today, Pavan.
Thank you for having me. Glad to be here.
So you're originally from Irvine, California, and you graduated from University of California.
Yes. Yeah, I went to UC Irvine in 2017, graduated in 2017, and then immediately moved to New York City to start my MPH at CUNY SPH.
Oh, wow. So you came to New York for this degree?
Yes. It had always been a dream of mine to move to New York City. I just knew it was the place I wanted to be and wanted to eventually pursue some of my bigger goals.
So you had a BS in public health sciences and a minor in business management, but why did you choose CUNY SPH and why specifically your MPH?
My entire educational background has been by the grace of public education system. I went to Irvine Unified School District for my K through 12, which is one of the largest public school districts here in Southern California. I went to University of California system, which is just a bit smaller than the entire CUNY system itself. And I've always prided myself at the education I've received from these great institutions, especially as a student leader, being involved in student government as young as in high school and middle school. I continued that trend in my undergraduate, and I obviously did that as well when I attended CUNY. I think I've just always had a passion for, being in the public education arena. It's not that I've not had exposure to the private education system. Obviously, my own family has gone through graduate school in the private university systems and my own friends, but I felt in those areas I've been able to just meet students from all walks of life. And also, I think the opportunities presented to me by attending a university like the CUNY system or the UC system really propelled me to pursue some of my bigger goals, like becoming a doctor.
Definitely. You were president for the SPH chapter of the Delta Omega Public Health Honor Society. You actually started the CUNY SPH chapter, and the school is very grateful for that. So tell me why that was important to you.
When I started in 2018, the school was relatively still in its infancy, branching out from Hunter College. It was a very big point for me to just solidify our role as a student government association. We really did not have much representation within the own CUNY governance system. So that was one of the first and foremost things I addressed, as a graduate student president, being involved in the CUNY-wide student government meetings. Plus, the ranking of our school, I thought, it was something that would forever serve the school and also build a community within. So I'm pretty proud of it, and I hope it serves the students well in the long run.
It definitely does. And what advice do you have for other students looking to get involved, take initiative, and become a leader at their school?
So I think the first step is being able to identify where you can actually make a difference or where you feel you can be the most effective. I think being able to actually have some, pride in it or being able to take ownership in it, that's really what's going to make the difference, because otherwise, getting involved in something that you're not thoroughly passionate about is only going to drag not only that cause, but it's going to be a drag on you as well. So really identify a passion that you feel like you can give back to, wholeheartedly commit to.
Mm-hmm.
I think that's the first step. And to get involved, I think most importantly also is communicating with others. I think identifying, the students that are around you, the faculty, the administration. If you see problems or if you see future things that you could do to give back to the school, it doesn't always have to be something bad, right? There's also a lot of good you can just do to give back to the school, like being a peer mentor or helping students that are in lower levels than you or something. I think just being able to identify that, and that does take time. And so I often tell students that I mentor now, entering their first year of medical school or their first year of graduate, undergraduate, I'm like, you don't need to get involved in something right off the bat. And that's a very common mistake, because a lot of times, there's just that adjustment period to your own classes, social circle, your own routine.
Definitely.
So I always, say, hey, look, you can explore the opportunities, of course, in your first term, first semester, but just hold off a little, identify what works for you, what doesn't, and then get involved. Because not only will you be able to give the right amount of energy, but you'll also feel more secure in your academic goals as well as your extracurricular goals.
Yeah, and that's great advice, not to overcommit yourself. I think sometimes we do that out of excitement. We're joining a new school and we want to get involved in everything. And then you realize,
right,
I have papers, I have homework, I have things to do. So
yeah.
It's great to get your bearings first and then jump into things.
Yeah, absolutely. And I've obviously served in roles as president. I continually serve now as president for both CUNY SPH and University of California. It doesn't even have to be the title, but there is a workload no matter what role or position you're taking on, no matter how light it seems or how dense it is. And I think just being truthfully honest with yourself, this kind of factors in more of a time management and load bearing balance issue, but you have to definitely be aware of that, especially, for older students that are getting involved too. That's very important.
Definitely. And so while you were at CUNY SPH, you were participating in some field work and doing research at Mount Sinai. Can you tell us about that?
Yeah, absolutely. So when I was at SPH, I had thought about field work very early on. I think during orientation, it was very heavily stressed, and I was obviously new to the city as well. So I was looking for a different type of career and just the type of job I wanted to be involved in. So I had applied to an internship program for the Department of Public Health and Epidemiology, which was involved with the 9/11 Health Project at Mount Sinai. And when I got into that, it not only fulfilled the requirements for the field work, but it also was able to highlight areas that I was passionate about, because it was working with first responders and rescue workers that were part of the whole 9/11 rescue operations. And it was very eye-opening to me because I was like 6, 7 years old when it had happened. And to then be, 25, 26 years old conducting research. And, it's a very affected population even today. They're suffering different types of cancers, different types of cardiovascular issues, neurological issues, you name it.
Mm-hmm.
And it was very eye-opening because when we think public health, we often think community-based initiatives or preventing diseases, things like that. But there's also things that people are just exposed to in their lifetime or in their field of work that do cause problems 10, 20 years later.
Mm-hmm.
So I actually continued that outside of field work. It became a whole job and career in itself because I moved from the Department of Public Health and Epidemiology and the chief of medicine for the Department of Internal Medicine at Mount Sinai ended up keeping me on, making me a full-time researcher for the 9/11 project. And then that kind of further propelled me because I was doing laboratory work, obviously patient interactions, and that propelled me into getting involved with COVID-19 research. I was part of the team that launched the long-term COVID effects study at Mount Sinai because Mount Sinai was one of the largest hospitals that was hit with the largest influx of patients. So, I think being on those large projects that cover tens of thousands, hundreds of thousands of patients, it really opens your eyes to the type of impact public health can have in these niche fields. You can always find an opportunity where you might not think it exists.
Definitely. And it sounds like the field work that you did as part of your time at CUNY SPH, you really were able to parlay that into other opportunities and knowledge.
Yeah, absolutely. Being at Mount Sinai really opened up other doors for me as well. As I've obviously progressed through school and through my career and building that, I then followed up and, further advanced that by going and working for the federal government at the National Science Foundation, where I did even larger national and international level projects. So I think my passion for EMS started just at home at Newport Beach Fire Department in California and elevated all the way to Washington, D.C. In just a span of a few years. So you can never really underestimate what an opportunity might bring or a passion might bring out.
Definitely. And that's quite a journey.
If you dream of making a difference in the world, a public health degree or certificate can give you the tools to do just that. The City University of New York's Graduate School of Public Health and Health Policy equips public health professionals to advance not only a healthier New York City, but a healthier world for us all. We want you to join us in our mission. Visit sph.cuny.edu to learn more about our programs. No matter where you are in your career, CUNY SPH offers a broad range of degree and certificate programs to not only help you advance in your career, but to have a real impact on the world. Public health professionals are needed now more than ever. Join us. Visit sph.cuny.edu to learn more.
You're currently enrolled at Medical University of America in the Caribbean, and usually pre-medical degrees start at the undergraduate level, but you got your bachelor's degree, then your MPH, and now you're going for your MD. What made you decide to go to medical school?
So I had always had a passion to get my medical doctorate and become a physician, but there were other factors before I just wanted to become a doctor. I do not come from a background of physicians necessarily, at least in my immediate family. I have some uncles and cousins here and there who are in medicine and are obviously MDs, but my immediate family, they were not in it. And I was never really forced into it, or nor was it, you have to do this or choose this type of career. I wanted to do it because I just saw inherent issues within my own family that really triggered even my own passion for public health. Diabetes is very common in the South Asian community. I dealt with it firsthand in my own family and saw the ailments that plagued my grandparents, my mother, my dad, and I saw it proliferate throughout, friends and other family members. And I think growing up with those type of constant, the run around to doctors, the different issues that kind of just come along with being a diabetic and other compounding health issues, starting around probably like 15, 16, I'm like, there has to be a way to handle this better and in a different way. So I wanted to see, is being a physician the only way to make a difference in medicine or preventing such a disease, right? So in undergrad, obviously, I just needed some of the basic science qualifications, that type of stuff. So I think no matter which way you cut it, you are going to need that. I think my decision to pursue my MPH first was very important because I knew the rigors. I had shadowed doctors starting in high school. I went into EMT training in high school. In college, I obviously worked with the fire department. I also worked in the police department as well. So I'd kind of seen different avenues of what we have as American healthcare system, right? So everything from your clinics to the hospital to the people you call if there's a serious health emergency and you need 911. I want to see, because of the rigors, because of the challenges, and also going to medical school is very expensive. Doctors these days, we're walking out with $500,000 plus of school debt. And I've been lucky enough to not have a lot of school debt up until this point. And even now, I want to see, can I, be financially stable before I enter medical school, and what other opportunities exist, because it also takes up 5 to 10 years of your life. Eventually, I think being able to build a career with my bachelor's, my master's, starting a company, being able to just kind of make an impact in other areas really proved to me that, okay, I can use my MD now to elevate causes that I was already involved with without medical school. Because when I entered medical school, I can tell you a lot of the people I met right off the bat, that was it. That was as far as people had thought. And the type of person I am, I think ahead, So my plan was never to just, hey, I need to get to medical school and become a doctor. That's it. I'm done. It's, hey, I can get there. Getting into medical school is the hard part, right? Once I'm done, though, what am I going to do? And how am I going to really make the most out of it? Is it going to be just seeing patients in my local hospital? That was not something that was ever the driving force for me. That's why I chose public health, because I wanted to make an impact on a bigger level. So getting involved in things like large research projects, going to work for the federal government, starting a healthcare company that dealt with the business aspect of it, which is very under highlighted throughout, all parts of the healthcare education system. That's a huge chunk of how the American healthcare system works. So I think being able to get exposed to that, being able to build a background and network in that really is going to help kind of the future goals I have of what I want to do with my MD.
So what are those future goals after you obtain your medical doctorate? I know it's hard to know so far in advance.
Well, yeah, of course, it definitely is. But I've done some pretty good planning so far, which I'm hoping, obviously, if all goes well, I'd be on track for. But when I'm done, all said and done with medical school and getting licensed and everything, I started a healthcare business back in 2018, which really focused on healthcare capital investments, education, especially in biotechnology and other tech startups in the healthcare realm. So I think, being able to scale that to a larger level is one of my top goals. But I also did serve in the federal government at the National Science Foundation, which exposed me to all branches of how the healthcare system is governed, the laws that impact it, the different organizations, groups, so many different facets that I don't think the common person would understand, and let alone even the physicians and advocates today we have. So I see myself going back and definitely doing public service. It's one of my big things to either run for public office, since we don't have a lot of medical representation in places like Congress or in our cities and larger bodies of governance that oversee these matters. And I think it was definitely highlighted during the COVID-19 pandemic, that the people who were talking about these issues were not qualified medical professionals. And I think needing that representation, especially as healthcare is becoming more of a prominent issue for most Americans, is very important to me. So I hope to give back entering the public sector, as well as also being able to really expand my business opportunities and some of these strategic investments with technologies and companies that are emerging now that are really going to be the forefront of healthcare. And I think we also see that in a light where medicine technology it can be slow to embrace or it can be very, very fast. It's one of the other polar ends for a lot of people or a lot of organizations, but it is changing and it's changing rapidly. It's not something that's been heavily invested in until these past few years. And I think COVID really accelerated that. Moderna is a great story of that because Moderna prior to COVID-19 had nothing, right? They were a startup company. And essentially, you can say overnight, they became a multi-billion-dollar company.
Definitely.
Through their COVID-19 vaccine. Nobody would have predicted that. They were working on several trial drugs, but that was not their focus of getting into the vaccine business at all. So I think recognizing opportunities like that, or one of the big things like that was part of the Affordable Healthcare Act, which has been slow to obviously embrace, was the entire country was supposed to modernize our healthcare record system and be on EHRs, right? But in 2022, the technology has been very slow to permeate through the entire country, partially due to funding, also the type of technologies. These technologies don't communicate, but there's a lot of companies that are popping up now being able to integrate this to state, city level. It does really require a large network.
Definitely. And electronic health records have a huge impact on data security, and it's really the future of our information.
Yeah, absolutely. And I mean, I think we pride ourselves on having laws like HIPAA and all that, but we also don't even understand the technology behind it. I mean, we've had major issues with that type of security. I mean, I do think it's an area that will become very prominent in the next few years.
Definitely. It'll be important to have very knowledgeable leaders in that place. So I'm glad that you're taking a look at that.
Yeah, absolutely.
So what advice do you have for other public health students or professionals taking a non-traditional path to medical school?
I think you have to understand what your end goal is outside of public health, because public health itself has so many opportunities. Not everyone understands what you can really accomplish within public health. In medicine, a lot of it will just end up becoming, I'm going to run a clinic or have a private practice, or you're going to be working in a hospital. There's a very small percentage that go into things like research and academia, specifically in the MD or DO routes. But if the route is medicine, which I know a lot of people do use, get their master's public health or MS in public health, I think still, even with that, you really have to evaluate, is this what I want to do? Because you have to definitely look at how much time you're willing to sacrifice. Obviously getting a master's takes anywhere from a year, 2, or even 3, 4 years, depending on the pace you're able to finish it at. And a medical school, all said and done, can be anywhere from 4 to 8 years additional. And that takes a lot of mental stamina and also a lot of personal commitment.
And money.
Yeah, money is definitely also very critical. I mean, there's not a lot of funding for graduate, and especially at the MD or PhD levels, it's extremely competitive to get funding for those type of degrees. So I think being able to recognize also the financial implications, I mean, it is disheartening. And I've been a very big advocate of the barriers of getting into higher education, especially graduate degrees, because even to apply to medical school, there is a financial barrier. It's, applying to medical school is anywhere from $2,000 to $5,000, depending on even how many times you apply. If you don't get in the first time, which is very common. And I think there's a lot of harsh realities that come to light. So exposing yourself to medical professionals, especially people who are in the public health field. So one of my biggest inspirations came from a doctor I worked for, and he eventually became my mentor. And now we're friends. But he was an MD, MPH, and he took a very similar route as I did. Being exposed to that really gave me confidence in pursuing, kind of taking it off route. And if you don't have that exposure, I think it's very critical that you do, because otherwise you're kind of just running in the dark. I think that can be very detrimental, because time is money, and then there is hard money also, the actual financial cost of it. Taking those MCAT exams, preparatory
Yeah.
courses, applications. Every medical school application, it averages anywhere from $125 to $200 these days, if not more.
Yeah.
Early exposure, a lot of exposure is very critical. And also understanding the realities of it, because I think it's one thing to just say, hey, I can get into school and I can get the degree, because the application process is probably the hardest part, right? Like if you're able to get in, once you're in, it's just like any other degree, obviously the rigor, but the life realities are very different. So if you have a partner, if you have children, if you have financial difficulties or need financial assistance, those are very real conversations people need to have. I don't think a lot of students expose themselves to that very early on. And that is very critical. Like, can you really be without a partner for 4+ years? Can you have this financial instability for 5 to 7 years, and being able to give up just parts of your life? Like being in medical school for me right now, I have to give up a lot of things. I don't get to see my family for months on end. I don't get to spend time with my friends. I miss out on events all the time. Those are realities to deal with. Those are definitely implications you have to think about, and what sacrifices you're willing to give.
Yeah.
So not to be demotivating at all, but I think you just have to really take a look at, hey, what am I willing to sacrifice of my life for the next 6 to 8 years?
Yeah. And all for a greater good in the long run.
Of course. Yeah.
So what takeaways do you want to leave our listeners with?
One of the biggest things I would love to highlight is, no matter what level you're at, whether you're just starting off in undergraduate or you're thinking of graduate school or career change or anything like that, I think is looking at things from a wide perspective. I think being able to draw out different solutions, no matter what path you're choosing, is very important. It's very bold to think, everything is going to go smooth, especially if you're committed to attaining these higher degrees. It's not an easy path, no matter if you're a genius or if you barely pass. But it is crucial to, have backup options, because people change, goals change, life changes as a whole. So I think being able to plan those things out is very, very critical. And also evaluating it. It's not just a one-time activity. Checking in on that every semester, every couple months is very important. And it just builds a better practice. It can help you refine your goals in life in general, and, just the way you pursue things. And while you're achieving your education, making sure you're in tune with the university that you attend is very important, because I have to attribute a lot of my growth and success with my ability to stay connected to my schools, because it's an investment, right? No matter what university or job or anything you choose to get involved in, if you're just going in and you're clocking in and clocking out, sure, you'll get your certification, degree, whatever it is, or you'll get your paycheck, but that's all you'll get. And I don't think people should look at it that way. You're spending your time there. So while you're there, you might as well get involved, meet some people, and stay active in the community, because the school wants alumni to come back, to give back to students, and also help alumni to grow and develop also. It's a two-way street, right? The school benefits, you benefit. And I've seen that time and time again, whether from undergrad to graduate school. Number one complaint is, I wish I'd done more. So just get involved in something, get in touch with your alumni office, get in touch with former students, or go to some of those school events that they have. Do something, because those people, no matter what year you graduated or what company you worked for, they will be there over that one time you're there for a couple months or a couple years.
Yeah.
So that is very, very important.
And you can get involved even after you graduate, which I think is a very important message that you have.
Absolutely.
Thanks again, Pavan, for being a guest, and thanks for listening to Making Public Health Personal, presented by the CUNY Graduate School of Public Health and Health Policy in New York City. You can now share, like, and subscribe to our show on Spotify, Apple Podcasts, Google Podcasts, Amazon Music, Audible, and on our YouTube channel. To find out more about CUNY SPH, you can visit sph.cuny.edu or connect with us on social media. We're on LinkedIn, Twitter, Facebook, and YouTube. Just search CUNY SPH. This is your host, Laura Mioli-Farragon, signing off. And while public health has a global impact, that doesn't mean we can't make it personal.